this video, I'm going to demonstrate a way to get in and mobilize our spinal cord. So our spinal cord and our brain are covered in this thick connective tissue called dura. And a lot of times, just from our everyday habits and everyday positions that we do, we tend to get stuck in areas of the dura, and our connective tissue surrounds our nerves. So the spinal cord is central in our spinal canal, and then we have nerves that go away from it in what's called the peripheral nerves, so the periphery of our body. And these nerves are also wrapped around in connective tissue. So what we're going to target in this series is a way to get from the top of the head to the sacrum, we're going to get that area mobilized. So the first part is going to start with a movement. And I'm going to go to the side here. You want to position yourself on the edge of a chair. And it's preferable that you're in a harder surface on a chair. And we're going to start a rocking motion with our pelvis. Notice as you do this rocking position with your pelvis that the head will move. This is what we want. And we're going to accentuate it here in a little bit. Notice when you rock the pelvis forward, it creates a slight nod of the head. Notice when you rock the pelvis back, it creates a slight extension of the head, or a nod back. So this in and of itself is a great way to mobilize the nervous system. We're going to do it again, and this time let's use breath with it. We'll take the inhale in the rock forward and the exhale with the rock back. So this is driven by pelvic movement here, and your lower legs, your hamstrings and quads are going to kind of help out with that action. It's really mostly hamstrings and spine that's going to help you out with this. But really it's kind of a coordination of all the muscles together. And it might feel really awkward to get this to start. So if you have a hard time with the breath cycle to sequence it, try to just get the movement first and bring the breath cycle in later. We're just going to do 3 here. We're going to do an inhale, rocking pelvis forward, exhale, back. Inhale, forward, exhale, back. Inhale, forward, exhale, back. So that's the first step in the mobilization of that spinal canal, our spinal cord that's wrapped in that really thick connective tissue called dura.